If your car's not running perfectly, take it to a train garage. Your brain is the most complex machine in the entire world, and it integrates with everything else in your body. Why would we think that for some reason there wouldn't be people that would understand that better and be able to help us operate it smoother, give us a maintenance plan, and all these other things to keep it in that order? I always think about the body like a machine, and except it's just so wildly complex that we need help and we need to educate ourselves. And you can never stop learning about the body, in particular the mind. Yeah, seek out people, any type of therapy, particular mental health therapy, and that would help our system.
Welcome to Mind My Age, where we explore the journeys and wisdom behind healthier, more fulfilling aging. Today, I'm excited to have Dr. Mike Wahl with us. Dr. Mike holds a PhD in medicine and is not only a leading expert in health and wellness, but also a passionate educator, researcher, and advocate for healthy living at any age. With over 2 decades of experience, Dr. Mike has made significant contributions through his work in clinical health, public health, and corporate wellness. He's also known for his innovative approaches to improving health outcomes, including his popular TED Talk on the continuum of health and his engaging health series called Health Explored, which reaches over 50 million homes. So, Dr. Mike, let's start with understanding the continuum of health. You've developed this concept and it's been widely recognized in both clinical and public health circles. For our audience, can you break down the key stages of this continuum and explain how they can navigate towards better health, especially as they age?
For sure. And I think that most people that are working in the health sector, so I'm a professor of medicine, which means I teach medical doctors how to be doctors, but at the same time, I don't practice medicine myself. But I worked in allied health for years and work with all sorts of patients. And what I found was that our healthcare system tends to wait until somebody is sick before they start to treat them. And the reality behind that is that we're always moving in one way or another. No one's 100% sick. Even when they've got a devastating disease, there's other aspects of their health that's still functioning well, and there's no one who's 100% healthy because every one of us have at least something that's challenging us. And, and about 40% of us have five medical conditions at one time. So the reality is the continuum is more along the lines of we're all moving in one direction at a different time. We need to know where we fall on that continuum. And if we have no health literacy, all we're doing is waiting for a bad test from our doctor instead of taking action ourselves and improving our health on our own terms.
So, what are the top three things everyone should understand about managing their health on this continuum, particularly in their later years?
Yeah, I think it's that a lot of us don't realize what our initial risk factors are. So, for example, like predisposed doesn't mean predestined, right? So, a lot of people know that we've got family history. So they assume, oh, I'm going to get diabetes because everyone in my family has. They don't realize that these are risk factors that allow us to take proactive steps to improve our health as we go forward. That's one of the first things. The second thing is that a medical doctor is there to help, but they're way more effective when they're working with you in the process of maintaining health as opposed to treating sickness, right? So a lot of the time people wait until they've gotten to that point when things are already bad and they should have been addressing it sooner. And then the last thing is knowing where you stand. For example, if a test gets worse, even though you might not be in that categorical sick category yet, you might be moving towards it, and give it long enough, you will eventually get to that sick point. So instead, knowing our baseline, what direction are we moving so that we can take proactive steps while it's still easy?
I love that. You've discussed that being healthy is not a binary state of sick or well. So, what's one common misconception about health that you've encountered in your research, and how can people reframe their thinking to achieve those better outcomes?
Yeah, and I think the research is one thing, but it's a practical experience, right? So, like, I started off my career working in gyms, and then I started working in corporations, working on oil rigs, and with different populations, every population you could ever really imagine. The thing about that is that it allows you to understand the personal struggles people have with health. And there's a lot of people in the world that are really capable in aspects of their life, and they don't like to have parts of their life they're not so good at. Right. And so I think that when they realize their health is declining, they live in a little bit of denial until they finally get that diagnosis of being sick. And so that would probably be the biggest thing. When I say it's binary and that that we There is no real cutoff point where the diagnoses you as being sick or me as being sick. It's just, I think that's the biggest insight I've learned from individuals is that we tend to shy away from things that we don't feel comfortable with. And the fact that we don't educate people on health unless they take a degree specifically into it, predisposes a lot of people to a lot of anxiety around illness.
In your practice and research, you've seen how stress impacts health. What's one unconventional method you recommend for managing that stress that our listeners might not have considered?
Yeah. I was really fortunate to look a lot at mental health when I was doing travel. And one of the things that we have a lot of in North America, in particular here in Canada, is nature. And I think that we do value nature and we think that it's important. It has an impact on our health, but I think we underestimate just how powerful that is, right? Like we have like the longest coastline in the world, and water has an incredible impact on our mental health. And just going at the end of a day and looking at water or having a water feature, even listening to an app when you fall asleep of water, these are all things that actually have a marked psychological impact on us. The other thing is that we spend time in nature, but we sometimes don't get the most out of it. I went to Tokyo and I met with the founder of forest bathing or Shinrin-yoku, which a lot of people have heard of. And I've been on a zillion hikes. I live on the East Coast Trail in Newfoundland. I literally was hiking out before we had our call today. But when I went there, they used all five senses while we were in nature. So they would stop you in the middle of a bridge, right? And then they would say, stop and listen. And there would be a waterfall hidden behind a tree you never would have known was there had it not been for them to have a little sign to say, pay attention to what you're missing. We would drink herbal teas and then do mindfulness conversations. And halfway through, they had cedar chips that smelled a certain way. When you walked in them, it felt a certain way. And so I think that those are some of the things that we undervalue that are readily accessible and are also accessible regardless of our socioeconomic status, right? Everybody has a little bit of nature somewhere close by that they can immerse themselves in. And it's free and it's easy and it's something that's ingrained into our genetics, I think.
And when you think about in all of your travels, what's one small yet powerful change everyone could be thinking about doing in their day to day toward helping them in that health continuum?
I'll tell you a bit of a personal story here. My father passed away, and the reason I started to do all these travels and step outside of the realm of the corporate world and structured research was because he asked me to find happiness. He knew that I had been successful by traditional terms, but he knew that I genuinely wasn't happy. So he asked me to find happiness, and it just so happens that the University of New Brunswick in Canada trains a lot of the senior educators from the Kingdom of Bhutan, the one place in the world that started measuring gross national happiness, and they put it above GDP. So if it's a policy that improves the health of the happiness of the people, they implement it. So I traveled there to learn about happiness, to follow through on this promise to my father. And the one lesson I learned from there, I think that is applicable to everybody, in particular in North America, is that they're happy because their definition of happiness is very different than ours. Our definition of happiness is joy or exuberance or massive accomplishment. It's this ecstasy that we experience when we get something new or accomplish something major. Their idea of happiness is contentment. It's having enough. It's being in an even keel. It's being in a nice neutral state. And I have redefined my definition of happiness since traveling there. And I can say I'm much happier as a result of that. So I think that's something everybody can evaluate and say, look, maybe I'm looking for the wrong thing.
It's so true that therapy can help you with your past reflection and un- unblocking the experiences you have had and making sense of them all, but also it can be as simple as helping you as a coach into your future and how to navigate your opportunities and challenges as you go along. And a lot of people don't realize the latter, which is everyone needs a coach. Best athletes have a coach. And so why not have a coach through your aging journey? It could be really powerful.
If your car's not running perfectly, take it to a trained garage. Your brain is the most complex machine in the entire world, and it integrates with everything else in your body. Why would we think that for some reason there wouldn't be people that would understand that better and be able to help us operate it smoother, give us a maintenance plan and all these other things to keep it in that working order? I always think about the body like a machine, and except it's just so wildly complex that we need help and we need to educate ourselves. And you can never stop learning about the body, particularly the mind. Yeah, seek out people, any type of therapy, particular mental health therapy, and that would help our system. We're struggling in, especially this generation, with anxiety and depression, and and then in the seniors, loneliness, which is a killer, right? And so these are all things that could be really that are helped by having somebody to talk to.
So, Dr. Mike, thank you so much for sharing your insights with us today. For our listeners, if you're ready to take control of your health and move towards the healthier end of the continuum, stay tuned and click the subscribe button to Mind My Age below. For more inspiring conversations, remember your best years are still ahead. Thank you.